So I've just received an order for a handheld nebulizer with 2.5 milligrams of albuterol. So I'm going to make sure that I get my medication in a unit dose. And I'm going to get a brand new nebulizer. I'm going to go to my patient's room. Wash my hands, knock on the door, address the patient. Hi, Mr. Jones. I'm Julie, your respiratory therapist, and your doctor's ordered some breathing medicine for you. Is this a good time? Great. Have you ever taken breathing medicine before? No? I'm just going to sit you up a little bit so you can get your medicine a little bit better. Can you tell me a little bit about what brought you in today? Okay, good. Can you verify your name and date of birth for me? Awesome. Thank you. All right. I just want to take a quick listen to your lungs. So if you would, take some deep breaths in and out through your mouth. All right, I'm going to take a listen to your back. Great. All right. So I'm just going to check your pulse, see how you're doing. So I'm also checking the pulse and the respiratory rate at the same time. So I'll check the pulse for 15 seconds and then I'll check the respiratory rate for 15 seconds. All right, good. I'm gonna get my medication ready. I'm going to take my scanner from the computer. I'm gonna scan the patient's ID bracelet. Just gonna scan your bracelet before I give you this medicine. Then I'm gonna scan the package of the medicine. Type in my computer. I'm gonna put the medication, the whole unit dose, in the nebulizer, assemble it. So I'll have to put the T-piece on and the mouthpiece and add the reservoir tubing if it's included in the package. I'm going to use an airflow meter. And I'm going to turn this up to about 8 liters per minute. I'm going to have and before I do that, actually, I'm going to tell the patient how to do this. So I'm going to describe, when I turn this on with the gas, it's going to make a fine mist. I just want you to breathe in and out normally, and every once in a while, take a deep breath. And then I turn it on. Okay. So the patient's going to hold that. I want to make sure that the patient's upright. I want to make sure that my nebulizer's upright. So if I need to, I can sit them up a little bit higher. I want to watch and make sure that mist is getting sucked in. That way I know that he's not breathing through his nose, that he's breathing through his mouth. If it's continuing like this, then I'm going to have to remind him to breathe through his mouth. Every once in a while, I'm just going to say, okay, take a deep breath for me. And I'm going to, and then when it's about halfway over, so maybe 3 to 5 minutes into it, since this is the first time I've done this today, I'm going to check a pulse rate again. If the pulse rate is 20% higher than when I started, then I'm going to stop the treatment, document it, and get a hold of the doctor to let him know. I'm going to get his respirations again. Make sure everything's okay. And I'm gonna run this until I hear it sputter, which kind of sounds, so remember, each nebulizer has a little bit of dead volume. So even after sputter, you may still have some liquid in there, and that's okay. When I hear the sputter, I'm just gonna tell the patient, okay, you've taken all the medicine. I'm gonna turn off the nebulizer. I'm gonna empty out any of my liquid, usually into a sink. And then to clean the nebulizer, I can take it over to the sink, and I just want to take some saline and squirt it in there just to clean it out a little bit. And I can put it back together and just hang it with the patient, or if I can, if there's a patient bag, then I will usually leave it disconnected and to let it dry in the bag. Some therapists will turn the airflow meter on to like a half of a liter, 1 liter, and just let it continuously run, and that helps it dry out as well. I'm gonna ask the patient if they can cough. So can I hear you cough? And I'm gonna monitor whether the effort of the cough, what it sounds like, and whether or not they produce any sputum. If they produce sputum, I'm going to monitor how much, the amount, the consistency, and the color. I'm going to ask the patient if he has any questions. So do you have any questions for me? Are you feeling any better? Good. Let me take a listen to your lungs again. So listening to the lungs again will allow me to know whether or not the medication was effective. So I'll listen for a change in sounds, but also for an increase in any aeration that might be going on. And if the patient doesn't need anything or have any questions, I'm going to reposition him. So do you want me to lay you back down or sit you back up? So I'll see what he wants me to do. And then I'll let him know, hey, you might feel some shakiness. Sometimes that's a side effect of the medicine. So if that happens, if you feel a little shaky, that's normal. And the doctor's ordered this for you 4 times a day. And it's about 11 o'clock, so I'll be back a little bit before 3. See you in about 4 hours. And then I'm going to leave and wash my hands again. All right, that's good.